Yes, ma'am. Please.
Good morning. My name is Gurleen. I'm one of the registered nurses in this clinic. Could you please confirm your first and last name for me?
You can call me Jenny Cole.
Right. And is it okay if I address you by your first name?
Yes, it is. It's okay.
Right. Jenny, I have your medical records here. I see that recently you underwent a medical procedure. How have you been feeling?
Yeah. Yes.
Okay, so the reason we made this appointment today is to remove the stitches, and I'd also be redressing the wound after cleaning it to ensure it continues to heal well. But before I come to that, I would like to know if you have any concerns or questions.
Yeah, the doctor told me about that is a squamous carcinoma, and it is similar to cell carcinoma, which I am worried about the same condition. Can you please tell me about the condition?
Be natural to feel worried, Jenny. It can be overwhelming to receive this kind of diagnosis. So the medical
Okay.
squamous cell carcinoma is indeed a type of skin cancer. But I would not like you to be worried about it. Don't be alarmed because the surgery has already happened. We've taken the lesion out. So the chances of it spreading further are very unlikely. Right? But if it's okay
Right.
with you, I'd like you to talk about prevention here. May I proceed?
Yeah, you can.
Right. So there are two things I'd like you to do to make sure that it doesn't happen again. One, when you are home, please keep checking your skin to make sure that there's no discoloration or any changes in the skin. And number two, please make sure that you're regular with the follow-up appointments so that the doctor can detect anything that is not visible to the untrained eye. Would you be able to do both of these?
Yeah, I
Lovely.
can.
Great. Do you have
Yeah.
any questions so far?
Yeah. I am worried about the further surgeries. Can you please tell me about the surgeries if I may can um, proceed with the surgery in future?
It's normal to feel this way. I think I understand where you're coming from. I'm afraid I don't have that answer for you at the moment because this is not within my scope of work. But I'll make sure I'll
Okay.
get the doctor to speak to you about it. However, now that you're here, I'd like to focus on the prevention aspect of it. And for that, can I just check if you wear any sunscreen or you seek shade when you're out in the sun?
Yeah, I'm using a sunscreen. It is 30 IPS or higher maybe, and wear a hat. So I don't think I'm thinking that I'm taking this precautions as well.
Okay, that is great that you're doing this. And I would stress the importance of continuing to do this. It's crucial that you keep wearing a sunscreen. It's important that you keep seeking shade when you're out in the sun because this will greatly reduce the risk of any lesions developing further, right?
Yeah,
Do you
yeah,
have any questions about what we've discussed till now? You have
yeah.
Mhm. Any questions about what we've talked about till now?
Yeah, I'm worried about that. I'm already damaged. My skin is already damaged as I'm have a great sun exposure in my teenage. So now it is. I don't think it is now going to be well.
It's a
So,
reasonable concern to have. I completely understand why you feel what you're saying, but let me
mm,
reassure you that as long as you continue to seek shade and protect your skin during the peak hours using a sunscreen, the chances of
okay,
it developing again will be greatly reduced. So please just continue to follow these preventative measures.
all right, I will.
Hmm. If there are no further questions, may I check on your wound if it's okay? Any pain or discharge since the surgery?
Yeah, you can.
Right. Have you experienced any pain or any discharge since the surgery?
Yes, but I have a concern that it is necessary to remove the stitches for now. But as I am previously having a surgery, so I think the stitches is have to be there for my recovery of the wound.
I'm so glad to hear that you're actively taking an interest in your health management. Now, something I'd like
Okay.
to convey is that this timeline is carefully considered and assessed by the doctor. So trust me, this
All
is
right.
the right time for the stitches to be removed. And to ensure that the wound continues to heal well, there are 3 things you need to take care of. One, make sure that once I redress the wound today, you keep it clean, you keep it dry, and you keep it covered. Would you be able to do this at home?
Thank you, sir.
Yeah, sure.
All right, great. All I needed to do was
Thank you, ma'am.
consent. But this is how you could have performed this role play. If Ishan had asked me that question about the damage further, we could have completed this in the 5 minutes.